My name is Dr. Anderton, and I am honored to be your moderator for today's talk. As a doctor and a mental health enthusiast, I'm passionate about exploring intersections of mental health in workplaces, as this is this year's theme. And today we have an engaging lineup of speakers who will share their insights on today's on important topics. Today we only have 4 topics, which are burnout, stigma, work-life balance, and customer care, and all are under the vital umbrella of mental health and professional settings. So we are privileged to hear we have a mental health activist, a clinical psychologist, and a mental health specialist, each bringing unique perspectives from their respective institutions. In summary, our session will last approximately 1 hour to 1 hour and 15 minutes, with time management as our main priority. To ensure that we stay on track for everyone who's participating, I kindly ask that you keep your questions clear and focused on the topics at hand, because mental health is a very broad spectrum, and today we only have 4 topics in which we would like to discuss. Yeah, we have a dedicated Q&A segment at the end of the presentation where we'll address your inquiries. So thank you for being here today. Let's dive into the important conversation. Our first speaker will be Dr. Stuart Mbelwa. He's a mental health specialist at Aga Khan University. So he will take us through stigma of mental health in workplaces. So welcome, Doctor.
Thank you so much, our moderator, Dr. Masanja, for that introduction. I will start with introduction. As you said, today we are going to talk about mental health in the workplace, and our role here is to promote mental health in the workplace. To introduce this mental health talk, we are going to look at a deeper look at human behavior. Because when we're talking about behavior of the people at workplace, we are talking about the outcome of thought, feelings. So behavior is what we project our thought and feelings. So whatever behavior that will be observable in our workplace depends on how people think and feel. Basically, we'll be talking about self-awareness and self-care. And the theme that I'm going to cover in my part is how can I know others when I don't know myself? So we need to know ourselves in terms of our thought, feelings. And at the end, we're going to project observable behavior to others. So we need to understand ourselves in terms of our personality before we know others. And then we're going to cover the theme of how can I care others when I do not care for myself. In fact, we need to care ourselves in terms of thought, feelings, and behavior. In doing so, we'll be in a position at least to take care of others, what they are feeling, what is thought going on in their head, and definitely the behavior that will be projected outside. And the third theme is how can I predict the future of others while I cannot predict my own future. So here we are talking about everybody needs to ask themselves, where do you want to see yourself, let's say, in 10 years to come? Or where do you want to see your institution in 10 years to come? Or where do you want to see others in 10 or 5 years to come? So at workplace, when we ask ourselves those questions, at least we'll be in a position to think, to feel, and to behave the way we want our organization or ourselves how far to reach. So the flow of this discussion will be based on perspective of human behavior. These are the factors that influence human behavior. What are the factors that influence human behavior? Because here we need to look at the reason that we behave the way we are behaving. So it's very good to ask yourself, from which school of thought, from which school of psychology are you reasoning? So that at the outcome, we're going to project a certain behavior. So every behavior, there's a cause underneath that lead you to behave the way we are behaving. And then I'm going to talk about how to reduce stigma. So the breaking of stigma to people who are experiencing mental health, and in this presentation, I will use as mental health care users instead of mental ill individuals. Let's start with major 6 perspective of human behavior. As I said from the very beginning, that these are the factors which influence human behavior. In other words, we can call them schools of psychology or schools of thought. So whatever behavior we are projecting outside, at work, at home, in the community, is based on from which school of psychology are we reasoning. So we have 6 of them. Number one, if we're talking about humanism perspectives, that means we are looking at how do we love others? How do we experience empathy? How do we respect others? So when you respect others, when you love others, when you love yourself, that means you're observing from humanistic school of psychology or humanistic perspective. Another aspect is social culture perspective. Social culture perspective is a school of thought that is based on our culture and beliefs. What do we believe? Are we reason from our religious belief, from our culture? So from that perspective, we'll project behavior based on our culture and value. Another aspect is biological perspective. Are we reason from biological processing going on in our body? So here we're talking about the neurotransmitters, the hormone, and you should know that if you release more, let's say, dopamine, adrenaline, acetylcholine as neurotransmitters, you will reason from that perspective. And most of the time, if you release above physiological range, that means instead of talking in a low tone of voice, you start shouting. So that behavior that will be projected outside is geared by the biological process going on in your body. Another aspect is cognitive perspective. So here we are talking about how do we analyze things? How do we interpret before doing a judgment? What factors are we analyze before reaching a conclusion? Another perspective is psychodynamic. So here we are talking about the self-talk. Self-talk here is governed by ED, ego, and superego. You know, the interaction between ED, ego, and superego is what we project outside. If somebody asks you, can you think before you talk? That means somebody is asking you to speak with your mind before you talk, before you behave any behavior that will be observable outside. The another aspect is behaviorism, school of psychology, or behavioral perspective. So here we are talking about stimuli, response, and condition. And this is an aspect whereby environment mold human behavior. The way that we're exposed to a certain environment will mold our behavior. And then I'm going to talk about the social stigma, the breaking stigma, how we're going to reduce stigma. And before going to that, the 6 perspectives that I've talked about, when get altered, they are the one also influence abnormal behavior. So when we move to psychiatry, if those the same factors which influence behavior, when get altered, they are the one which will influence abnormal behavior, and somebody will call psychiatry. So when we're talking about social stigma, we don't prefer that term. We prefer people who are experiencing mental health challenge to call them as mental health care users. If you use that term, all of us, we are mental health care users, because at one point, at time we need to consult clinical psychologists, we need to consult mental specialists. If we have, let's say, we have lost our property, or we have lost our beloved one, or we have lost job, or you are bankrupt, it affects our mental health. So you can also consult psychologists, mental health specialists so that you can be stabilized. So here, we are talking about collaborating with mental health care users in the workplace. If somebody is experiencing some mental health challenge, we need to collaborate with him so that we can explore what is going on in his head, so that if at all we can be of any help, we can do something. Also, we need to visit community to share issues related to mental health promotion. So we visit churches, mosques, any other group in the community so that we can do mental health promotion. We can identify mental health challenge, people who experience mental health challenge, so that they can come and they can use mental health services. So when they come to the mental health setting, that is where we call them mental health care users. But those who are in community, let's say undiagnosed, left unattended. So those are people who are having mental illness, because left unattended, left undiagnosed, that can cause domestic violence, they can commit suicide and other psychiatric emergencies. And then we need to accept the people with healthcare users as colleagues, at work, as neighbors, as family members, because the stigma, of course, starts from themselves, but also the colleague can stigmatize a person who is experiencing mental challenge. And then we need to spend quality time with them so that we can collaborate with them and explore what is going on in their head and be able at least to help them. And we need to have friends, we develop friendship, because we don't need to isolate them. They are normal human beings. As I said, it is only that one or two schools of psychology is disturbed. So if that disturbance will be rectified and fixed, somebody will behave normal. So we need also to at least to encourage them to access mental health services. We need to invite them to into religious activities, to at least to participate in the meeting, in the church, at the mosque, anywhere, so that they feel normal. With that perspective, everyone will access mental health services, and we are not going to label them. We are call them mental health care users. We also need to help them with people who experience mental illness, to access mental health service. By doing so, that means they'll become mental health care users instead of mental ill individuals. So in conclusion, by reducing stigma, we create a very supportive environment that will encourage treatment and improve overall well-being. So here, people who experience mental health challenges, they can now adhere to regular medication. They can adhere, or they can consult clinical psychologists for counseling and other mental health services. And we need to partner with them, that they'll be involved in mental health promotion, and by doing so, they will inspire others who experience mental health challenge at least to access mental services, and then they become mental health care user instead of mental ill individual. Last but not least is to redefine mental health services users as active participant in the public mental health, and not a passive recipient, not a recipient of mental health service, but also to be part and have to be involved in mental health prevention, promotion, treatment, and if somebody has mental disability, at least to do psychosocial rehabilitation. Thank you so much. Let me hand over to my colleague Belinda to continue. Thank you.
Yes, thank you, Dr. Stewart, for that. For any questions, please do write them in the chat if you think you forget, but you can always ask in the end of the presentation for the talk. So our second speaker is Belinda Nendiwe. She's a mental health activist with Marcus Mwemezi Foundation. She will take us through burnout in workplaces. Yes, welcome, Belinda.
Thank you very much, Doctor. As I've been introduced, I'm a mental health activist. So I'll take you through burnout with actual experience. So whatever I'm gonna share with you today, it's something that I have experienced myself. When we talk about burnout, in this day and age, a lot of us are trying so hard to chase our dreams, chase economic uh, balance, yeah. And we don't give ourselves break because we are trying to chase something that um, in reality our bodies and minds needs breaks. I always share this with people when I talk about burnouts. Literally, when you burn a candle, it will it will eventually die out. Yeah. And it's the same with our bodies and our minds. If we don't give each other, if we don't give ourselves breaks, then we can easily burn out. Um, there are many ways on how we can control burnouts. It's some My colleague here is gonna talk about this life work balance after I'm done, um, because burning out, we always say burnouts are real, but we don't until somebody gets to a point where they're hospitalized because maybe their bodies are dehydrated or your mind is literally on the verge of losing itself and you're hospitalized. That's when you realize that I've been running a race without giving myself a break. So I'm gonna share a few things that I've had to learn on giving ourselves breaks and how to avoid burnouts. Uh, it's it's rarely you have time to exercise because you're overworking yourself. You spend a lot of hours maybe in the office. By the time you're out and you get home, you're physically tired, emotionally, psychologically tired. So it's very hard to give yourself even like 20 minutes, 15 minutes exercise, you know. But I think it's very vital that we start taking care of ourselves because um, mental health is just as important as physical health, and they go hand in hand. If your mind is exhausted, your body will be exhausted as well. So we have to learn how to take care of both physical and mental health. So it's very vital to give ourselves time to exercise, even if it's just like 15 minutes, you know. But if we do something constantly, it eventually becomes like you pick up a habit, and that will work very well for you. Also, just we need to learn how to separate work. Like we don't take work home or anywhere else, right? Um, so I think, yeah, okay.
All right. Thank you, Belinda. So, our third and last speaker is Erioma Arias. He's a clinical psychologist with Lisa Jensen Foundation. So he'll be taking us through two topics today, which are work-life balance and customer care. So please, Mr. Iruma, please, you can proceed. Thank you.
Yeah, thank you very much. As I have been introduced, my name is Iruma. I'm a psychologist from Linda Jensen Foundation. Together today, we will cover the work-life balance and customer care. The theme of this year is mental health at workplace. And later on, as I will be going through the discussion, we will now see like why is it important to speak of mental health at workplace. Mental health at workplace, it's a very crucial area of concern due to its direct impact to both the employees and the productivity. Because if a person is mentally and physically fit, we also expect like the productivity might be very high. So to start, we should first get an overview on what is mental health. According to WHO, they define mental health as a state of being, a state of well-being in which an individual realizes their own abilities, they can cope with normal stresses of life, can work productively, and able to make contribution to their community. If you try to look this definition, an individual must be able to work and produce to his community. And in defining this definition, we can see like all aspects of biological, psychological, and social aspect have been covered in this definition. It simply refers to a personal emotional, psychological, and social being. And we can just see some of the mental illnesses. We have depression, we have anxiety, we have mood disorders, and we have another one which is known as workaloism. This workaloism, I think it might be a new terminology to some people, but this is a tendency whereby a person have this compulsive of keep working, don't want even to detach himself from the work, even when it's time to go home. Mental health affects how individuals think, like the first speaker have been telling us. It also affects the way we feel, and later on, it might affect our behavior. Good mental health, it just means not only the absence of mental health, of mental disorders, but also it means being able to make decisions, also being able to, having resilience, being able to bounce back from challenges. Is there a relationship between work and life? I meet some people who they tell me like, we are staying at work and we are going to visit home. This seems like we use a lot of our time working and we forget that there are other very important aspects of life that we are supposed to carry them hand to hand with our work. Therefore, there is a very big relationship between work and life. Try to consider the hours that you use them at work and also think like, how are you using the remaining hours? Is there a balance between the time that you stay at work and the remaining time that you go home? Is there a balance? But actually today, we will deal with mental health and customer care in relation to work. What is work-life balance? Starting with this one. Work-life balance refers to achieving a state of equilibrium or balance among different aspects of life, including work, personal interests, family time, and self-care. Here, a person is able to keep their priorities, and this actually means not only dividing the time, but creating the harmonious integration that supports personal fulfillment and the productivity. It means ensuring that time and energy are effectively distributed between professional responsibilities and personal needs, which at the end, this leads to overall well-being. Why is work-life balance important? When we think, why do we need to balance the work and life? A balanced approach helps reduce stresses and burnout, and therefore improve mental and physical health. Together with this, it enriches relationship with family and the friends. You know, always when a time is allocated for relaxation and hobbies, relaxation produce serotonin and the dopamine hormone, and these hormones are very common to in regulation of mood, and also social interaction can prevent chronic stress, and we know chronic stress is a major contributor of burnout. Also, to promote health, how does a balanced work life is important? It is important because it promotes mental health by reducing depression and anxiety, and bring also it enriches our relationship, because when we have time for families, and we that means we get time to stay with our families, making some of the activities which are more related to our families. It always a balanced work life is important because it also allows individuals to engage in activities outside of work that bring joy and meaning, such as hobbies and exercise that I've been speaking about it before. And later on, this will bring about job satisfaction and the productivity. And a person must be productive because he is focused and he is recharged. What are the signs of unbalanced work-life situation? These are some of the signs that when you see, it now gives you some of the information that there is an imbalance between your work and life. This can be manifested in various aspects of personal, physical, mental, and the social well-being, such as increased stress level. In increased stress level, a person might present with persistent stress that is difficult to manage. Also, there is chronic tiredness and low energy. The person continue to feel tired and have low energy, and sometimes leads to low morale, because when we relax, we have to relax physically and mentally. Now, because there is no balance, we don't get this type of relaxation. And again, it is decreased the productivity and performance. We must have decreased the productivity and the performance, because an employee become not focused. He is not focused, and also he is not recharged, as I've been said before. Also, it may lead to health problems and strained relationships. Health problems may present like a person might have physical symptoms like headache, muscle tension, and also a strained relationship, because there is no an equal distribution of time between the family and the loved ones. But also, let us look to the signs of a balanced work-life situation. We have also a signs for balanced work-life situation, which there is clear boundaries between personal life and work. Individual with balanced work life has clear boundaries. This is time for work and this is time for family. Also, enjoyment of hobbies and the personal interest, they also pay attention to leisure activities and thus recharging themselves. Also, there is high level of productivity and focus. There is increased productivity because of efficiency and focus. There's positive relationship because there is an equal distribution of the time, and also emotional resilience. Resilience, as people can bounce back easily from challenges. Now, we might be asking our questions like, how now can we bring this balance? Now, how to balance work life is by setting the boundaries. We set the boundaries by knowing this is time to live from work and it's time for the family. And when it's time for family, we have to give our wool to the family and concentrating to the family. And when we are at work, we have to concentrate with work and leaving the family aside by that time to keep the boundaries. Again, we have to learn to say no. Sometimes a lot of employees, we know that we are working to get money, but sometimes we have to say no, because an employer might ask you, like, can I use your free time? I might want to use your free time tomorrow because there's a work that I want you to do and I'll be paying you money. You can just say, okay, yes, I will just do it because we are doing to get money. But sometimes we have to learn to say no, that we have also to give the equal time to our family and the loved ones. Also, we have to be organized, like putting our timetable clear to avoid being running with chasing the deadlines, and also integrating your work and life. When I say integrating your work with life, is there are some of the there are some of the activities that a person can carry when he is at home, but this might not work in every kind of job. But to some jobs, there are some of the activities that might be carrying them at home while still staying with the family and helping your children with homeworks. Again, is use your quality time with loved ones. When we use our quality times with our loved ones, we increase the boundary, we increase the bond between us and our loved ones. And at the end is like we increase emotional support and strengthen our relationships. But there's this tool. It's known as urgent and important matrix. It's a tool that is used for time management. This tool might help individuals or us as a team, and it's used to prioritize tasks based on urgency and the importance. As you have seen, this tool have 4 quadrants: quadrant 1, quadrant 2, quadrant 3, and quadrant 4. Quadrant 1, these are we have those activities which are urgent and important. When we have activities that are urgent and important, we have to do these activities. These are activities that requires immediate attention and have high significant consequences if it's not addressed. Example, responding to a crisis or pressing deadlines. They are very essential to do them. Therefore, if an activity is urgent and important, then you have to do it. In the quadrant 2, these activities are not urgent, but they are important. When you have activities that are not urgent, but they are important, you can just plan. These activities might be like having a vacation with the family. You can plan doing them in some other time, but don't skip these activities because they are very important in your growth. Again, we have activities in quadrant 3. These activities are urgent, but they are not important. If these activities are urgent, but they are not important, you can delegate these activities. You might tell a friend, you might tell a colleague to go on behalf of you. They are time sensitive, but they don't contribute significantly to your growth. Example, some of the meetings, you can delegate them to other people. Quadrant 4 falls to those activities which are not urgent and not important. These activities which are not urgent and not important, try to eliminate them. These are activities that consume much of our time, like staying in social medias. We have to learn how to minimize these activities. Okay, having carried you through that, I'm now going to carry you on the last part of my presentation, which it is customer care in health setting. Although I've been covering the health setting most of the time, because I know we might have different customers and different places that we can speak of the type of the customers, but for the purpose of learning today, I've just prepared customer care in health setting. First, we have to understand that customer care is an approach and a practice that is used to provide high-quality services and support to patients, their families, and the other clients that are interacting with healthcare facilities. Now, we have what connects us with customers. Is it only the knowledge that we have connect us with our customers? No, it is not only the knowledge that we have connect us with our customers, but empathy and understanding our clients also connect us with our clients. We know in health settings, we sometimes meet clients or patients who really gave up and they don't even hope for tomorrow. So showing empathy to them connect them to us. And again, it's understanding. Although I like to use the way imagine, because sometimes we might not understand what people are going through, but we can just imagine what a person is going through. But sometimes understanding, you might meet a patient who is, let's say, having substance use disorder, for instance, alcohol use disorder, and now you try to communicate with him, not in a good way, not encouraging him, but also but remember that you have to understand the situation that he is going through. Again, is effective communication. Effective communication helps us a lot to communicate with our client, our customers in health setting. I always ask myself a question. For instance, in a hospital setting, when a patient is coming, who is the first person a patient come encounter with? The first person that a patient come encounter with is a person who is we call a security guard. He is the first person that come in contact with our patient. So the way the security guard will treat the patient, showing him empathy and understanding him, he can still move with hope, coming to see a doctor with hope. But if the way the security guard have approached our patient or our client in a negative way, a patient will always come discouraged, and sometimes they come when they are angered. Also, follow-up care is very important, and the consistent and the reliable services. If you are a doctor, you are there to provide services, be available and be approachable. The service also that we are offering to our customers, it should be reliable. And sometimes the way we communicate with our patients, we have to learn how to differentiate ourselves from the assessment tools. Because sometimes a patient come and you carry some of the tests and you find that the patient is not sick. And you use this term, you tell the patient, Haumi, you are not sick. I don't think that is a very good way of communicating to a patient, but you can just tell the patient giving him a very genuine answer, like we have carried some of the samples and we have carried some of the tests, but it shows that the tests have shown that currently you are not sick. There you are giving a patient another chance to choose on another alternative, the alternative way. Or sometimes we might get the patient who come at our health setting centers, and for instance, they know at 9 p.m. we have to see the doctor, but it's around 10 and the service is not yet started, and the patient might ask you, it is 10 and the service have not started. Now you start being aggressive. You are telling the patient, we are also human beings, we get tired. No, just be genuine and give the genuine answers, like whether the doctor will excuse me, the doctor today I've just late because of some few reasons, but we are trying to put the things right. What are the type of the customers in health settings? In health settings, we have customers with expectations. They are coming with expectations. They now know when you go to a certain health setting, there is a type of service that we are getting from that health center. So they are coming there with expectations, or we say coming there with assurance. We also have customers who comes for confirmation. They are just coming to confirm what they have been hearing from other people. And we have customers who come for inquiries. They are just coming there to inquire some of the informations. We also have customers who comes with their answers. So sometimes a customer come there, but she or he already have the answers. So as Dr. Stewart was telling us about the psychology part, psychology now can tell us the pattern, the behavior, this pattern of behavior of our customers, and knowing how to communicate with them, how to navigate with this type of customers. What are the important things to consider? Know how you communicate. Yeah, communicate using professional ethics. Give genuine reasons. Also understand. To understand your organization behavior, listen to your customers. If you want to know what the behavior of your organization, you might get this from the customers that you are serving every day. Always research plus a patient and evidence-based intervention brings about client-centered approach. We want to attend the client as a person. We also have, as medical personnel, we have to update our knowledge, as there's a lot of everyday technology is it's increasing. We have new technology every day. We have to expand our knowledge. And also we have a lot of articles that are coming every now and then. We have to go through those articles because if you attend patients and we use practical-based interventions, we can come to a very good ending. So my message for today is this: in the hustle of work, don't forget to prioritize your mental health. Having said all this, I want to return the platform to our moderator to welcome people for questions. Thank you.
Thank you, Ellie. Yes, so we are coming near to the end of our talk. We had seen different topics. Of course, we had 4 topics whereby we had stigma, burnout in workplaces, work-life balance, together with customer care. Yeah, which is one of the person in the comment wrote, I love the link between work-life balance and mental health, with perspective with customer care as we are currently commemorating the customer care week. So let's dive into our first question from Bonnie Ntega, which was directed to Dr. Stewart. Dr. Stewart, this is yours. So he writes, thank you, Dr. Stewart, for a nice presentation in Breaking Stigma. You have introduced a new phase, which definitely you have introduced a new phase. I personally did not know this about mental health care users, rather than saying mental health care with illness or patients. So to my thinking, users can be applied in both situations such as wellness and illness. Okay? So don't you think this might be confusing in terms of wellness, especially when you really want to capture the ones experiencing mental health issues? As in, when you say mental health care users, you're actually including those who are mentally well and those who are mentally unwell. So maybe you can help clarify that, please. Thank you.
Thank you, Bon, for that very good question. Actually, I meant when you're talking about mental health care users, we are talking about mental health promotion, early identification of mental health challenge, early treatment, and also taking care of those who are experiencing mental disability. So all of us, we are supposed to be mental health care users. Let's take an example of when you lost your beloved one, or you lost job. Because when you're talking about depression, it's loss of something. You experience some kind of sadness, mild depression. It depends how are you going to cope with that loss. Simply, for example, you lost your mobile phone. Those 2 to 3 days, you will experience some sadness feeling. And if you fail to cope, if you fail to build resilience against that particular loss, you need to have expert services from, let's say, clinical psychologists, mental specialists. So here we are moving from when you visit mental health unit that you are a mental ill person. No, you are mental health care user. You want to use mental service to stabilize your emotional strength, to stabilize you to cope with the psychosocial environmental stresses that you are going through. So it covers both those who experience mental health challenge, those who are mentally sick. Those who are mentally sick, we encourage them to access mental health services. And if they be in a position to access mental health service, they become mental health care user. And those who are in the community, undiagnosed, left unattended, those are the ones who are mental ill individuals. So we encourage them to access mental services so that they become mental care users. So this is combating social stigma against people who are experiencing mental health challenge. Because one can avoid to go to the mental health unit because will be stigmatized as a psychiatric patient. So we encourage people to use mental services. For example, if you have lost a beloved one, before any complication, you need to access mental service so that you'll be stable. You will normalize whatever psychosocial environmental stressor that you have encountered. Yeah, I don't think if I've addressed your question.
So he reports here, well explained. Yes, well explained. Thank you, Dr. Stewart. So we have another question here, but adding up on that, I remember when we were having our first aid mental health first aid training, we were always told to describe mental health as liquid, something which is changing, meaning your mental health status is changing at every time. At one point, you might be well, then something happens, then you're unwell, then something happens, then it changes. So at any point of time, you might be well, then you might become a potential mental health user. So the status keeps on changing. So it doesn't mean when you're maybe when you're unwell, you'll remain unwell. Maybe when you're well, you will still remain well. So let's just keep that in mind.
And to add on that, actually, my colleague here, Yaruma, mentioned about relaxing, taking leisure. You know, when you laugh, when you relax, you release natural neurotransmitter called endorphin. Now, the endorphin is the one which boosts up immunity, control heart rate, and make our health, our psychosocial well-being good. Have you ever heard a statement says, if you laugh, if you relax, you increase your days of living in this world? So there's a scientific proof. When you laugh, when you relax, you release neurotransmitter called endorphin. So one can consult a psychologist to do the technique of making himself to relax, to enjoy, to laugh. And this is coming from psychoimmunobiology, that when you laugh, you boost up your immunity. So when you boost up your immunity, you're combating non-communicable disease. So, but when you combat it, because when you are angry, you release more adrenaline, catecholamine. So your blood pressure will go up. Your blood sugar level will go up. So your immunity will go down. So you welcome opportunistic disease like cancer, high blood pressure, and diabetes.
Thank you. We also have another question here from the chat. I guess this is directed towards Ruma. It writes from Felix M. Says, thank you all for the amazing presentation. I have one question. How can I prioritize my well-being while staying productive at work?
Okay, thank you very much for a very good question. If sometimes we try to ask people, like you have also to do this little research. If you ask people, what are your priorities? People might tell you like, okay, my priority is my family, my work, my car, whether my dog. People prioritize other things and they forget themselves. So I want first to let know someone who have asked the question. I don't know the name. I'm sorry that I'm addressing him. Felix. Yeah, Felix, you should come the first. In everything, you should be the first. Now, how can you prioritize this? I've been explaining some of the ways that you can use. First is like putting the boundaries. If it is time to disconnect yourself from work, disconnect yourself from work and go home. And when you are home, when the calls or the emails, which are either the emails which they are not that much important to answer them on that time, You just keep them and answer them on the next time when you are at work. Also, you have to give time for your family. When you give time for your family, you do the production of the hormones that Dr. Stewart have been saying. They feel good hormone, and when they feel good hormone and neurotransmitter is secreted, we increase the day of living in this life. So in my presentation, I've been showing some of the ways, and it is like where I've been explaining right now.
Okay. Okay, another question from Felix M. At what stage would someone with mental issues or need clinical or hospital intervention? I guess this is directed to all of you. I guess who will be answering this?
Okay, let me answer the question. Thank you, Felix, again. At what stage would someone with mental health issues need clinical or hospital intervention? We have a lot of mental disorders. We have depression, we have anxiety, we have PTSD, we have somatoform disorders. Now, this is very wide. So answering directly, like when you have these symptoms if you have these symptoms or if there's change of behavior, it's now the time that you need to go. You need a clinical attention or you need a psychological intervention. It is really, really very difficult because we have a lot of mental disorders, and each mental disorder have its own symptoms. It is characterized by its own symptoms. Therefore, we don't have general symptoms for all mental disorders. Each mental disorder have its own symptom.
And sorry, can I go first? Yeah, just to add on that, in fact, if the disturbances, the mental health challenge, disturb or incapacitate somebody in his daily living activities, that is a high time to seek medical attention. If the mental health challenge disturb, incapacitate somebody's daily living activities, that is a high time you need medical attention. Otherwise, as Eloruma said, if the mild symptoms, they can be managed psychologically with mental services, and life goes on. Thanks.
Yeah, just to add on that, as Dr. Stewart presented, that we need to take care of each other. There's one issue that we have in our communities is also lack of awareness when it comes to mental health issues. So it's very hard for you to know that, okay, I've reached a point now, I need help. But if we're able to see a colleague or family member presenting some symptoms that show this person is heading into like a mental breakdown, we need to help each other. And I think that's the time when we need to head to get professional help.
But I think to add on that, let us help Felix with one of the common mental disorder, which is depression. Depression is characterized by persistent sadness and lose of interest. It does also have some symptoms like feeling of guilt. Sometimes a person might even having a suicidal ideation. So if a person is characterized by the symptoms that I've been mentioning, it is a high time to look to search for clinical attention.
Thank you. Adding up on that, seems there's a question here. It seems from Monica Monisi, which reads, it seems men are prone to get silent mental health, I guess, issues because of quietness than female who overtalk. So is there any proof of this? Here, the floor.
Yeah, if I can go first. There's what we call ventilation of feelings. Actually, women tend to ventilate their feelings, to air out their feelings. By doing so, they allow other perspective from another person. So, ventilation of air is gas exchange between carbon dioxide and the oxygen. But the ventilation of feelings is to air out your feelings and to get another perspective on your feelings. By doing so, actually, you are in a position to cope with the situation that you are encounter, but also to build resilience. Now, for those who keep quiet, who don't share their feelings, actually, they tend to release more catecholamines, acetylcholine, adrenaline. So they affect their body. By releasing those more catecholamine, they affect the heart, the immune system, and other parameters. So they are prone actually to develop other physical illness, like hypertension, as I said, diabetes mellitus, cancer, and so on. And that's why if you see, especially at advanced age, more men dies than women. So it's because we tend to have poor coping mechanism, and also we don't have very good stress strategy management. Thank you.
But I think this is also a cultural thing. Like, men are not supposed to cry. Why are men not supposed to cry? They have feelings. They can't share. They can't. You bottle everything in because I'm a man. A man is not supposed to show weakness. A man is not supposed to show emotions. All these factors really weigh in on men, and they tend to be more depressed. They tend to have more suicidal ideations than women, because, as Dr. Stewart said, I will go and have a talk with my friends and I will share everything. I'll air out everything. So by the time I get back home, I feel much lighter. Some weight has been lifted. So I think it's time now we teach our young boys, if we have kids, we teach them that it's okay. You can be a man and still show emotions. That way, I think we get the next generation, yeah.
But I also think, like Monica been asking, it seems men are prone to get silent mental health. When we speak of mental health, it is a positive thing. I think this should be, men are prone to get mental disorders because of their quietness. To get mental disorders, not to get mental health. Mental health is a positive thing. And like my colleagues have been explaining, to add up on that, it is what now we want to break. We want to break the chain.
Yes.
Lisa Jensen Foundation wants to break the chain of stigma. Dr. Stewart was speaking of stigma, and he just tried to give us a few about internalized stigma and social stigma. Internalized stigma, a person stigmatizes himself. As you have been telling us about the culture, other cultures might a man is reared in a way that he cannot communicate his feelings, because communicating his feelings is the sign of weakness. Now we want to break that chain, showing that also men can have mental disorders and they can also communicate to get help.
Yeah, and in addition, a man who does not air out his feelings, at the end, develop emotional wound. And that emotional wound left undressed. It's like a physical wound. Physical wound needs dressing. But for the emotional wound which remain undressed, that means that wound will remain there and cause complications.
Yes.
The complication, yes. So we are supposed to heal whatever emotional wound we have by air out our feelings and get a professional help.
Thank you, Tim. Any more questions from the floor? Okay. Yeah, I guess those are all the questions for today. One of Bonnie did comment here, you can be a man and still show emotions. That was a good take from Belinda and Nandiwe. Well noted. Thank you. Yes, me as a man, I pass that that message.
That's great.
Definitely, yeah,
And
definitely. We can be a man.
for healthcare workers, let's say nurses, if you haven't addressed up your emotional wound, how can you take care of others?
Yes.
Actually, you
Yes.
may cause more harm to them because you haven't addressed up your emotional wound. For customer care, you cannot give customer care if you are experiencing an undressed wound yourself. How can you give good customer care?
But doctor, I also think like it's a good time to send a message to the employers also to understand that we must having like these workshops that help our employees to air out, to train them.
Sure.
I think that also can help. Having those psychologists who they can implement the situation before the situation is worsening.
Sure.
Yeah.
And also to know the bosses, to know their personality, and sometimes their subordinate behavior is a reaction of what they are doing to them. And that will affect productivity.
Yeah.
Definitely. Yeah.
Okay, so there's another question from Gesong Paul. Men dying early, is it because of emotional challenges or because of age gap during marriage time? I
I think
personally,
both can be applied. Both can be
yes,
applied. But the most important thing is stress, psychosocial environmental stress that men are experiencing.
do you think,
Sorry,
yes?
go ahead.
So do you think that men, especially in marriages, we are over dependent on our wives for emotional support, psychological support in such a way when they are gone on or when we are left alone, we lack that support, and that's why we either we die early or something like that.
For
Of
example,
course, adding upon that question.
for example, during advanced age, we tend to differ our thought, feelings, and behavior due to the biological process going on. A woman who is at a menopause stage and a man who is old enough, and let's say, take an example of, let's say, sexual desire. A man during advanced age, they increase their sexual desire, but their performance is down. Now, for the female, post-menopause, they lost their sexual desire. That's also caused stress to men. And when you talk about economical status, the purchasing power, when purchasing power is gone for men, it causes a lot of stress. And again, the stress will lower down immunity. By lowering down immunity, it means you invite non-communicable diseases, cancer, high blood pressure, diabetes mellitus. So the stress management is very important for men, especially at the advanced age. And sometimes you find men prefer to get married to the young girls during advanced age. They think that they are going to manage the stress. However, they complicate the stress. And the coping and resilience also fail. So that is my perspective.
On the second question that been posed by the moderator, he asked like, if we lose our spouse, we die early. Is it because of either there is a connection between the two? But actually, it's good if we speak the facts when we have the research and we have the findings. Because losing for instance, I losing my spouse might have a very quite different definition with somebody else losing his spouse. For instance, a person might lose his spouse, and from the moment he lost his spouse, is the time now he starts being happy. He is happy because I have lost my spouse, because of the life that they were living together. So it is good to get the interpretation of an individual, because that is very subjective. You might get his own answers. They might give you very different answers. So it's good. I think it's an area of interest that we will have to go and do the research. We are coming with the results that they have scientific evidence.
But
Thank you.
just to add on that, we hear a lot, like when a man loses his spouse, a lot of there's a saying that this one will not last long, because we have seen in the society, men, it's different from when a woman loses the husband, they tend to stay a lot longer than when a man loses his wife. So
Yes, definitely.
Mm.
Yeah. So I guess as the early woman said, research should be done, huh?
yeah, research
So
should be done.
we have evidence-based, not only words. Of course, it's a common saying in our country here. When mume wako kama mke amefariki, possibly yani the husband won't stay very long.
Yeah.
Okay,
So
we're coming.
there are a lot of uncertainty. So we need to research so that we can come up with evidence-based
Yes,
for then practice.
definitely. So time is of the essence, and we are coming to the end. So one more question can I say here? It's on the floor by Gesson Paul. So can one relieve mental illness by treatment if the causative agent is not settled? I think mental health is very vital and however very complex to address. Please share schedules for next session. We would like to continue learning how to cope. So I guess the question is on the top here. Can one relieve mental illness by treatment if causative agent is not settled?
Okay, mental disorders treatment, they are in three categories. We have a biological treatment that we give medication. We have a psychological intervention, like using therapies, and we have a social intervention. Now, always we deal with what's the terminal thing that we deal with is the cause. What is the cause? Therefore, understanding the cause, it's one of, we say if you know the cause of the problem, we are in a 50% way through to solve the problem. So addressing the cause of the mental disorder, it's a first step towards achievement. So yeah, a person can be treated if, because some of the mental disorders might first require medical intervention. After medical interventions, then psychological intervention, then social intervention. And when we talk of social intervention, we talk of the support from the family members, the support from the loved ones. So yeah, a person can get treated.
And to add on that, we have a concept which says cause related to effect.
Mm-hmm.
Cause, we're talking about the background, we're talking about the history, what happened to cause that onset. The effect, that is our challenge, that's the present time. So every behavior that is projecting now, there is a cause underneath. So the cause is the background, the cause is the past, the cause is the history. So in mental health, normally to identify mental health challenge or mental illness, you have to do thorough history taking.
Yeah.
History taking is the one that we can identify mental disorders. We don't diagnose by using laboratory tests. We don't diagnose by checking blood pressure, temperature, history taking. Thank you.
All right, guys. So we're coming to a close. It was a really nice talk. So we had seen it all today. We had seen stigma in workplaces, especially when you're facing a mental, you're facing yourself a mental breakdown on how to handle others and how to handle yourself and how to care about others while you're also caring for yourself. We also saw burnout, whereby someone can recognize symptoms in which you yourself can feel that you're overwhelmed with work and how to handle it. Together, we finished up with work-life balance together with customer care, which of course they do align. How to handle people which we service, because most of us work in areas whereby we service people, and how to balance the work together with our lives. All in all, thank you for everybody who participated today. Thank you very much. And I don't know if people are asking if we're going to have another session. I don't know if we're going to have another session, but hopefully we will. What I would like, and we can put it in the comment if you want the same speakers, or we can also add on. I can also be a speaker for you guys, not only moderate.
You're
But
welcome.
thank you. What I wanted to say is welcome, guys. Today at Aga Khan, we had a very good day, a mental health day. We had different presentation from different foundations, including Lisa Jensen Foundation, a New Now Foundation, and together with us, Aga Khan, as Aga Khan Mental Health team, we also had a very nice presentation whereby we talked about different aspects in mental health. This doesn't end here. On Saturday, we are also going to have another, what we term as a walkathon. Yeah. So it's going to be fun and games. It will start at 6 a.m. in the morning, just around about at the beach area around there. Everyone should arrive by around 6 a.m. By 6:15, I guess everything should be started. I have put a link on the chat bot whereby everybody can log in and register. If you register, you will get a free t-shirt and there'll be water, of course, and refreshments while we're working for the walkathon. There'll be two routes, the 5 kilometer and 10 kilometer route. I would advise everyone to join. It will be so much fun, and come and join, and it will be amazing. So this will also be part of the mental health um, form of relieving stress, right? And of course, the team will be here. I don't know about Dr. Stewart, but I
10
know
kilometers.
I will be there. I will be there.
10
you'll be
kilometers.
there.
I will be
Okay,
there. And
thank you.
I will manage. I will manage.
But I know Belinda in the room will be there. So
Yeah,
don't be
we'll be
afraid to talk to us and ask us any question. And thank you all. Thank you very much.
Thank you.
Thank you so much, and bye-bye.
Thank you. Bye.
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 Cheers. Bye.
Next session, please. Sorry for interrupting.
Yes. Yes. Somebody said anything?
When is the next session, please?
The next session. As I said, we don't know when the next session is until we organize, but we'll definitely let you guys know. Yes. As the same platform which you had the link for uh this session, I guess we also get the link the same way. Yeah. All right, guys. Bye. Cheers.
Okay, take care.